Hello, welcome again to the University of Kentucky's graduate program in rehabilitation counseling, rural rehabilitation class. This session we're going to be focusing on the administration of VR programs in rural areas. So please, while you're viewing this video, please open and access the PowerPoint entitled Administration VR programs in rural areas, and please follow along with me as we go through this material. In this session, we want to talk a little bit about issues related to administering VR programs in rural areas. And if you look at larger state systems or even smaller local systems, there are some very distinct challenges that occur or are present when you're trying to administer programs for persons with disabilities in rural areas. Some challenges are distinctly relative to larger programs, such as the public VR program, which runs statewide, and they have to deal with the metropolitan, the micropolitan, and the rural areas all under one policy umbrella. And there's some very distinct challenges and barriers for that type of program. But there are also some smaller programs, local charity programs, local job programs that are specifically trying to provide services in rural areas, and they also have some barriers as well. So we'll be discussing some of the barriers to administering vocational rehabilitation programs in rural areas, some of the factors that are out there that are present that we have to sort of utilize, or issues we have to deal with when we are developing rural rehabilitation services. Some of the administrative challenges that are out there, some strategies to address some of these issues, and then we're going to talk about some resources that are out there. Because one of the key things when you find yourself in an isolated area or in a unique position, the worst thing you want to do or need to do is try to take action in a isolated manner. You've got to pool what limited resources you have, and that's one of the key things, successful pieces in terms of providing services in a rural area that we have seen, that there has to be some interagency cooperation. So we're going to go through quite a few of the resources that are available that the person administrating or the group administrating a rural program or a program in a rural area should consider when attempting to address certain barriers and factors related to rural rehab service provision. Moving on to slide 2, let's talk a little bit about the barriers that are present when we talk about VR programs in rural areas. First of all, the main one that we've discussed in several other of the videos, just the lack of employment opportunities. There's higher unemployment. Typically, what employment there is highly competitive. You have a lack of you might have a lot of low-tech entry-level jobs, and then some higher paying jobs, but not much of a middle class type jobs. Maybe inability to for people, there maybe not be a career ladder. They may not be able to move up in their career, which is not a positive aspect. That's not something that we want. There just aren't generally many employers in rural areas. What employers tend to be, also is physical work or agricultural work that many times ends up being more of a referral source than a source for jobs. So that's one key issue that we have that faces just about every rural area. Vehicle repair and transportation, obviously huge issues, because when you get into rural areas, you just don't have access to transportation, and many VR programs can't provide vehicle repair, and they aren't able to help the individual get a vehicle fixed so that they can stay in a job or to maintain employment. So some agencies may, but by and large, that's not something that VR programs practice. Also, if you have one family car and it doesn't even belong to you, that's an even bigger factor. 4 or 5 people using a vehicle. How are you going to access work? So that's one issue. A huge barrier: transportation. There is no public transportation. Most rural areas, if they have any public transportation, it's Medicare or Medicaid funded, which only will, at the time of this taping, will take you to your doctor's appointment, but will not take you to any type of employment setting or for employment. So, transportation, a huge issue for consumers. Also an issue for staff as well, where you have to get staff to the various areas, because if the individuals cannot come to you or cannot get to a job, how are you going to get the staff and the services to those individuals? Assistive technology, and this is for various reasons, but often in rural areas there just is not an access to the assistive technology or those resources. The loan programs, they just don't exist in that area, nor the expertise. When you get into rural areas, you talk about more generalized services because we don't have specialties in rural areas. So and assistive technology is a very specialized area. Even urban areas have difficult times. There's such a labor market shortage of well-qualified rehabilitation technologists that there's definitely a sparseness in terms of the availability of those type of services in rural areas, and with many individuals who need those services, there's such a long waiting list that it often becomes very difficult for them to access those necessary services or acquire those items. Many of the policies, when we're talking about statewide programs or large programs, they tend to be urban oriented. They tend to focus on the areas that are highly popularized or have higher populations, and they tend to focus on, and they tend to forget a lot of these unique attributes of rural areas. So a lot of times the rural areas, because of their sparseness of population, your administrative staff don't necessarily consider all the issues, all the complicating factors, such as transportation. And in a urban, suburban area, metropolitan area, transportation is not a big issue. You have bus routes, you have taxi cabs, a lot more access to people that can take you here or there, a lot more access to jobs. In your trainings and your resource development may totally ignore those factors we've already talked about. So a lot of times we find that our rural service providers are left out in the cold in terms of training or even just policy development. Low wages are a barrier to administering VR programs in rural areas. And of course, you may be sitting there thinking, well, but it costs less to live in a rural area. And that may be the case in some instances, it may not. And I'd say that will vary widely over the entire country. For instance, when we lived in a rural area, gas was always more expensive. Food was more expensive. Now, housing wasn't as expensive, but they tended to counterbalance each other. Energy was quite expensive because the sparseness of population. You have to often pay a premium because the companies come in and they can't make as much money off fewer people, so they have to increase their prices. And then many times the businesses, just because of the demand for labor, if there's a high demand for labor, or a high demand for jobs, if there's a big available labor market out there, which many times you have a lot of people seeking employment, and you can pick and choose who you want. A lot of times you don't have to have as high wages because you don't have to use money to attract the best talent. You just have to be able to give them a job, maybe with some benefits. So low wages are an issue. In terms of again, even the larger or the smaller programs, hiring or training qualified staff is a significant issue, especially with something as specific and probably not as well known as the vocational rehabilitation program or VR programs in general. It's not something typically covered in your career counseling courses or your job exploration courses, and it's a unique program, and we have unique views and unique techniques that sort of combine a lot of different areas, many expertise areas, but there aren't often a lot of people that come in with that expertise that come in ready for a job. Many of your training programs in terms of VR they are at universities, which are typically in more urban or suburban areas, and if it's your typical graduate from a college who goes right into grad school and then straight into to career right after they get their master's, a lot of times they don't want to move to a rural area if they're not from there and hold no loyalty to that area. And if they do go, often they don't stay because they use it as a stepping stone. So it's very difficult to get those qualified staff to come from those master's programs, and that leaves you little options or fewer options. Sometimes you have to homegrown your talent, where you find somebody with good skills and then you provide adequate training for them to master those skills. But the problem with that is it's very expensive for the service provider, meaning a master's level degree, let's just say it costs $15,000, $20,000 to obtain. That could be low in some cases, that could be very high, but let's just throw it out there. Well, if you hire somebody, if you're a service provider and you hire somebody that already possesses a master's degree, a graduate degree of some kind, that's $20,000 you don't have to spend, especially if you're in the public program and you're not preparing that person to be a qualified rehabilitation professional. Let's say you don't hire a person with a master's degree. That's $20,000 you have to divert from providing services to the training of that individual, which makes it very expensive. If you don't train that individual adequately, then you run the risk of not providing quality services and providing these less quality services to people that are arguably more challenging and more in need than their than the other individuals with disabilities in rural and urban areas. So that's a huge area of concern, in that we don't want there to be a quality gap in our urban counselors and our rural counselors, our rural staff. So, and always quite a challenge. Another barrier is there's a lot of evidence out there is there's just not been much progress made in service provision. We have lots of evidence of increases in our quality in lots of areas, but when you look at rural rehabilitation, as far as a refining of the techniques, there hasn't been a whole lot of progress or research that's focused on this area in 15 to 20 years. And the rural areas certainly aren't shrinking, nor are the problems there going away. So that's another barrier that, even in developing this class, we found many dated materials. They were still valid, but many of the issues that needed to be addressed in further research just weren't. So, one barrier is that there's nobody out there, or there are inadequate researchers and professionals out there trying to close that gap or address these issues. Cost of services. Many times, because you are dealing, the individuals that you're working with have significant disabilities, and they have less opportunities for accessing those services. You have to get them to places that that have those services. So you might have to pay transportation, or because there may only be one service provider in an area, then you have to deal with, if they don't have any competition, they can pretty much charge you whatever you want. So the services become much higher. And again, as I kind of said earlier, the same thing when you're thinking about things like utilities, it's the same thing that goes with service providers. If in an urban setting, they can count on serving 300 consumers in a year and turning away 100, they don't have to charge as much to make the amount of money that they need to survive as a rural area, which may only have access to 150 but needs similar resources to stay afloat. So often the cost of services are much higher in rural areas. And another barrier that we see out there is just sort of a malaise and just a dependency on a generational dependency on public support. I've lost track of whether we're in our third or fourth generation that's dependent on public support, but as somebody that's provided services in a rural area, I can tell you that there are just many people out there with disabilities and without disabilities that are very content receiving that public support and don't feel as if they don't value the culture of work. And many times these individuals may be very competent and have the ability to hold jobs, and when you're sitting across from a desk, you end up trying to just encourage them to work, to consider the concept of work. They don't necessarily come to you for work, they come to you for services, and then you have to really push the thought of work there that's not a lot of times inherent. And that's not to, I don't want to broadly categorize all groups. It's just that is present in a good amount, especially these individuals who've been on public support for years and generations. It's just an issue and something you have to deal with. As we move on to the third PowerPoint slide there, we talk about this, there's just not many available services. So if you're not happy with a service provider, or a service provider isn't providing quality services, you're really over a barrel. You've got some issues. You don't have options. You can't say, oh, I choose not to use you, or if you do, then you've closed off access to that service provider. And we talk about in the ethics portion of this class some of the ethical issues related when there just aren't many services. So who do you choose if there's an issue between them and a consumer? Do you choose the consumer to advocate for the consumer, or do you choose to advocate or side with the service provider because it impacts more consumers? So that's something we talk about in that section. Another barrier is often when you're talking about bigger VR programs, larger statewide programs, your rural areas are farther from your state offices, your central offices, and often people just don't like to travel that far and get that experience, and they don't understand the experience of the rural service providers or individuals from rural areas. So you get that disconnect, a lack of understanding between that central office body that's making the policies and that rural service provider that's actually trying to get the job done, and understanding how each one operates. Another barrier is that many times service providers have to work across multiple counties / towns, and that means working with various political structures. A lot of times when you're in rural areas, your politicians, your county judge executives, or your county magistrates, or whatever, they wield a lot of power because they have jobs and influence. Your school boards. So a lot of times, when you're dealing with office space and referrals and employment, and you're working in a big area, and Kentucky is an example of a state where we have quite a few counties, around 120, which is a lot for a very small state. So that's 120 fiefdoms that we as administration have to navigate. And when we have to have a presence in each and every county, then you have to deal with office space and access to services and resources. And in some cases we find these systems easy to work with, and others we don't. So that's a very big issue when you're talking about trying to administer a program, especially in rural areas, because counselors, there isn't enough of a disability population to serve a very small specific area. They have to cover broad areas, so that makes it much more difficult. Another barrier is trying to locate offices in centralized or accessible areas. No matter what, if you're in a rural area, people are going to have to travel to get to you. So what's the easiest way to do it? Do you have one big office where you have all your staff together, you can pool your resources, or do you spread them out and have one-person, two-person offices, but having in areas that are accessible to the population, and also a place you can recruit staff to work? You have a lot of cultural diversity issues you have to deal with. Many times, if you think in terms of the statewide program, when you have a rural area versus a metropolitan area, many times that rural area it's a different culture. In Kentucky, we have an eastern part of the state is Appalachian in nature. It's a different culture. They have different tendencies. They have different, there's some different viewpoints of dealing with the government, dealing with service providers. There's just various issues that make it a little bit different. You also have, in some states you have the American Indian, Alaskan Native. They have a presence, and a lot of times if you're trying to work with them to provide services, while they have their own specialized programs, in some cases we may be stepping in to assist, and that is its own culture. And even though you may have your service providers locally understanding that, if your administrators don't understand that cultural diversity issue, then many of your policies and procedures can be counteractive to what you're trying to do as an agency. Also, just physical or programmatic accessibility. How do you get the word out? How do you get people to your building? Many of our small towns and local areas and rural areas, they just haven't, the ADA hasn't gotten there. As I used to tend to joke, it's word hasn't gotten there that they're struggling to keep their town afloat, much less install curb cuts. And yes, it is the law, but they're just, a lot of times they're doing the best they can. So we have to find ways to help these individuals. First of all, find us, and then get to us wherever we are, and that's always a challenge. Hegel in 1989, discussed some of the factors that are present when we're developing rural rehabilitation service delivery programs that we have to take into account and we have to deal with when we design programs or are monitoring or overseeing programs. One is population sparseness. Where are the people? How can we disperse our staff and our expertise so that we can provide for this in a fair and equitable way, so that as many people as we can receive services. That includes the distance from consumer services. We want to try to get these offices or these staff in places that they're easily accessible. Many times there are geographic barriers that you have to take into consideration. These may be, you may have a mountain range. I think of Colorado as a state I've traveled in, some where you have certain areas of the population where it's highly clustered, your metropolitan areas, even your resort areas, but then there's some rural areas where you may drive miles before you see another house. And you have to cross the mountain ranges if you go from one side of the state to the other, and it's very difficult for people to move freely sometimes during different parts of the year. So that may be a barrier, or just in terms of distance between areas, because you get so spread out because of the small population. So those are some areas you have to deal with. Climate barriers, sort of the same thing. Another factor are languages spoken in the community. Many times, some of our rural areas, they may have, there may be different languages. You may be dealing with, American Indian population. You may be dealing, rural areas in, I don't know, there are rural areas in Louisiana and Florida where different populations, like Creole is an example. And there are other, small areas where there are pockets of individuals that speak a very unique dialect or a very unique version of English, and if you don't have staff that can communicate with them, how are you going to address those issues? Cultural diversity sort of goes hand in hand with that. If you don't have people that understand the culture or understand how that culture works and views employment and views accepting services, and how is it a decision-making process in the family where they often defer to the head of the household? Those types of issues. If your counselors or your service providers aren't familiar with that, then, or your agency isn't aware of that and those unique attributes of those rural groups, then often you're going to have some service-related issues or some issues when you develop your policies and providing services in those areas. Another factor you have to take into account is the way the community communication issues and the power structures. Who holds the power in the community? Who are your movers and shakers? Is it the Chamber of Commerce? Is it the Board of Education? Is it the county magistrates or the judge executives or the city planner or the mayor? You have to understand how different communities interact and how you can get in with that area and interact. Is it the area development district? It could be none of the above. It could be, you might have somebody that's just a private citizen, that's a large business that holds sway in the community. How do you, you got to take that into account, and how do you utilize that to get your service out there and make sure people that need your service can access your service. Other factors you may have to address are what are the demographics of the persons with disabilities. When we talk about rural areas, we talk about a lot of very, very young individuals and a lot of very old individuals, just in terms of population living in rural areas. As they get old enough to go off to college, many of them don't come back. But we still have a population that's living there, that's lived there their entire life. So you might have to take that into consideration. You may have to design some unique services, not necessarily to keep people there. That's not our job. It's to provide services to the population that needs them. We have to consider the type of disability the individuals have, as well as the severity of the disabilities that tend to be there. In rural areas, we see high incidence of something like diabetes, health-related issues. So we might, train our staff to address those issues and be knowledgeable about the rehab techniques and issues related to working with folks with those types of disabilities. Then that's just an example. You need to know the history of the services provided. Has this been tried before? If you've had a strong presence in this area and it's not working now, or there has never been a presence in this area, why didn't it work? Why is it not there? Why is it working? You need to understand all those factors before or when you're overseeing or designing rural administration programs. You need to be aware of the available resources, and I talked about it earlier. When you work in small areas, you have to pool resources. You have to play as a team so that you can disperse such limited dollars in as effective net as possible. You need to be able to assess the expertise and attitudes of personnel and be able to utilize strengths, be more flexible when you're dealing with your staff, you might make them give them more sway necessarily, or more options or flexibility in making decisions. So long as it meets all legal requirements. But you need to assess that and determine: do I have the expertise? Are my staff willing? You may deal with issues where you have staff that don't want to cross county lines for various reasons. It could be something as simple as we used to play this school in high school and they were mean to me then, so I don't want to go over and provide services. Those are types of issues you deal with in rural areas. It's always a possibility that there are fear or racism issues among staff, and wouldn't think you would find that a lot, but if you have a culturally diverse population in rural areas, sometimes they will sort of divide themselves and isolate themselves, and one member may not want to go into a smaller culture or be afraid. There may be fear, so if they don't want to go, then that's an issue you're going to have to deal with. We always make this assumption that because everybody lives in a certain area that they all get along, which is definitely not the case. Not the case anywhere. Also, you have to understand the interrelationships that are often present, because they're you have your power structures, and because you're in small areas, people interrelate to each other on so many different levels. They'll see them in public, they'll see them at church, they'll see them at a restaurant or at the local grocery store. They'll have a cousin that knows so and so. So there's a lot of different interrelationships, and you have to be able to understand those and learn how best to address the issues that arise because of them. And also to be able to deal or to take advantage of those interrelationships and use them to assist you. Doctors Harley, Bishop, and Wilson in 2002 discussed how programs can respond to some of these challenges and some of these barriers we've talked about. First of all, they felt that programs need to address the needs of persons with disabilities as they perceive them, and I loved how they focused on that, because many times folks from urban areas or metropolitan areas don't understand why somebody would live in a rural area. They don't respect it. And this is not a blanket statement. I don't believe that's the view of everybody. But many times when people say, I don't know why somebody would live there, and they may go to a rural area and look at different parts of the town and perceive, well, this is a problem and that's a problem, and this is all stuff we need to take care of. But that's not how we really need to take this issue on. When you work with persons with disabilities, you need to see what problems, what issues do they see, and assist them in assisting themselves address these issues, and not going in and telling them this is how we think and this is how we're going to make these changes. Because if you don't have the buy-in from your local staff or constituents, you're not going to make it very far. And if there's one thing I've found that's fairly consistent, is that people in rural areas tend to resist when others from urban areas come in and tell them they think they should change. It just usually doesn't work very well. That's why they live in rural areas, because they don't want to be around people from urban areas and they like their independence. So as an administrator, when you're trying to make changes or you're trying to meet needs, what needs do they see? Talk to your constituents, your staff. You utilize their expertise and knowledge and discuss those issues with them before you start making changes or developing services. Programs need to be consistent with realities of rural employment opportunities. I used to work at a comprehensive rehabilitation center in eastern Kentucky, and much of Kentucky, as I've said before, is rural. We had a graphic arts printing training program, which did a fantastic job. When in its heyday, when it graduated a student, this individual knew how to operate the top of the line printing presses and do all the things that they would need to do should they go work in the graphic arts printing field, wherever that was. But the problem was, many of the individuals that we had would be going back to a rural area. So we were churning out 15 to 20 to 25 individuals a year in a program where, if you excluded the what we call the Golden Triangle, which is the Cincinnati area, the Louisville area, the Lexington area, where the more urban areas of the state were, there might not be 15 or 25 jobs statewide in rural areas for these people to find. And if they were, then they weren't good paying jobs. So, we developed a program that basically we spent 16 months training somebody for jobs that just didn't exist in their home areas. So when you develop these programs, you make sure that it's something that, if you're training them for something, that it's something that they can do, will be beneficial to them, that there's a market for it in a rural area. Programs, when you develop them or when you change them, it must be suited to the rural concepts of productivity and self-worth. Those that like to work in a rural area, they work hard, and many people work well up into their later years and want to be productive, and they want to contribute to their self-sufficiency and to society. And programs in rural areas should focus on that. You need to make sure that you adequately inform potential consumers about the consequences of services. And this is one issue that you often have in rural areas. You have many people that are on some type of public benefit, and for good reason. Many times they need to stay on public benefits because of that medical card. But there's a lot of misinformation about how earnings and work will impact your services and your public benefits. But people need to know, we don't want to lose that public trust that, provide them accurate information about if you work so many hours and make so much money, this is how your benefits will be impacted. Also, lastly, utilize distance technology. This is something that's being developed, and I think as we move along, that this will be probably the one technique that's being utilized that's progressing to the point that it's really can be beneficial to people in rural areas is the distance technology. You can train your staff, you can provide services through distance technology, and it may not be as quality as sitting in a room with somebody, but if you have a choice between not receiving a service at all versus receiving it utilizing distance technology, it's an option that you have, and it's better than nothing. So, make sure that as you're administrating programs that you keep that in mind. You keep that possibility in mind. Utilize assistive technology and make sure that you are, as we moved on here to slide number 7. Utilize assistive technology so that you can help a lot of these individuals with independent living, and they can maintain their independence in their home for as long as they can. Make sure you're getting knowledge of that service and access to that service in these rural areas. Focus on interagency coordination at a state level, at a regional level, at a local level, and it's important you do at all three, because state cooperation is very important. But if your two state, your state Department of Labor or Workforce Investment, your state VR, if they're getting along well, that doesn't necessarily mean in the local Workforce Investment Office that those groups are going to be getting along. So you have to really nurture those relationships from the top down. In the same way, it goes the same way when the state agencies have to, when they cooperate together, they have to provide a united front and be a model so that the regional and local offices see that that's the environment that they should be working in. And it's very important that this be done, and all three of these are taken into consideration. You need to alternate staffing patterns. Be flexible. Why do we have to be open 8 to 4:30 Monday through Friday? Maybe we need to be more flexible. Maybe we can have staff that can keep the office open 7 to 5:30, or open on Saturdays, or take into a lot of be more flexible. Utilize one-stops. They have valuable services. Utilize the services that they have. Consider self-employment. We talk a little bit more about that in the job placement portion, but that's a national emphasis. As talk about home growing our own businesses and the ultimate flexibility as far as employment goes. So consider that. Support employment. You need to make sure that you foster and grow those areas, because we still have high incidence of intellectual disabilities in rural areas, and we need to make sure that we're providing services to those individuals in those small rural areas. And again, lastly, encourage creativity. Your staff are on the ground. They see the issues, they see the challenges. That many of them have grown up in the area. Give them free rein. Give them the opportunity to be flexible. Set parameters, but be creative. Try to find different ways, so long as they're, again, legal and ethical, to provide services and develop unique partnerships. And many of the great promising practices have come out of rural areas because people were allowed to be creative, and they saw a problem and tried to solve it. Other strategies that we have that you might want to consider if you're designing or overseeing a rural area in terms of administration is develop relationships with businesses and large national employers. Walmart may be the only store in town, so develop a relationship with Walmart. Go to their corporate offices, contact their corporate offices, get in with their HR staff and get that word. And that's not always the best way, because you still have to develop those local resources, but a good way to get that information out is to start with the corporate offices and the larger businesses. But a lot of times they will have a presence in a rural area. Anymore, the big box stores are there, and the mom and pop shops, unfortunately, are disappearing. Make sure you always consider government employment. Many times that's the only middle class jobs in a community. You work for the school system, working for local government. Make sure you develop those relationships as well. State government opportunities. You help foster those resources for your staff. Develop relationships with state and local lawmakers. Let them know your dedication, your interest in those areas, and help them work with you to sort of address those issues that may come up related to the power structures in these individual areas. Because many times, some people only speak in terms of politics, and you have to utilize what connections you have, and a state and local lawmaker will many times be able to cross bridges for you or develop relationships for you that you could not develop on your own. So it's important that you foster those types of relationships. Focus on advocacy and accessibility in these communities. Help them understand what an accessible community looks like, and help the individuals learn to advocate for themselves to get changes made that allows them to be active participants in their community. There are lots of migrant service programs that are out there. Utilize, develop relationships with them, utilize the services that they have if that's a population that's present in your communities or in your rural areas. Educate rural staff about cultural diversity and emerging populations. As we have persons that come from outside the United States, they tend to settle in various areas. They have different cultures. It's important that we train our staff to understand those cultures and respect those cultures, because whether or not they necessarily agree with it, they should, ethically they're bound to serve them. So we help provide training to those staff regarding providing those services and that cultural diversity issues that they might have to face while they're dealing with those individuals. And lastly, in terms of the other strategies, focus on training that's relative to the unique needs of rural service providers. When we talk about training to these folks, consider transportation. Think about, how do I manage a caseload? of 250 people when I have to travel 120 miles to my one of my offices, or I have to travel 100 miles a day to get to cover all my counties, or how do we manage that? How do we how do you communicate effectively with cultures that live in this community? Or many counselors now don't think twice about giving an email out and utilize that as a case management technique. Well, many of our rural folks don't utilize electronic mail. So make sure that you provide training that's specific to the needs of counselors, and those are just some small examples. The last, looks like 3 slides, just discusses some of the resources that are out there. What I'm going to do is, for the video's sake, is stop the video. I want to restart. In part 2, we'll go more in depth into these interagency resources that can be of benefit to the rural administration of VR programs. Thank you.